Abciximab Platelet Aggregation Inhibitor, antithrombotic agent. Abciximab is a medication used to inhibit platelet aggregation, preventing the formation of blood clots thrombi in the arteries. It is formulated as an intravenous injection and contains abciximab as its primary ingredient. Mechanism of action: Abciximab is a monoclonal antibody that binds to the glycoprotein IIIa receptor on the platelet surface. This receptor plays a crucial role in platelet aggregation. Therefore, when abciximab binds to this receptor, it inhibits platelet aggregation and prevents blood clot formation. Applications: Abciximab is indicated for the treatment of thrombosis-related conditions, including thrombosis prevention during coronary interventions. Abciximab is used to prevent blood clot formation during coronary interventions, such as stent placement. Applications: treatment of acute myocardial infarction. Abciximab can be used to treat acute myocardial infarction, especially in cases requiring coronary interventions. Applications: treatment of stroke due to cerebral artery occlusion. Abciximab can be used to treat stroke due to cerebral artery occlusion, but its use in this case is still under investigation. Dosage and administration: the dosage and administration of abciximab are determined by the physician based on the individual patient's condition. Typically, the medication is administered intravenously over 10 minutes. Subsequently, the patient may receive a maintenance infusion of abciximab for the next 12 hours. Side effects: like all medications, abciximab can cause some side effects, including bleeding. Abciximab is a platelet aggregation inhibitor and may cause bleeding. The risk of bleeding may be increased in patients with a history of bleeding disorders, those taking anticoagulants, or those with liver damage. Side effects: headache. Headache is a common side effect of abciximab. Nausea: some patients may experience nausea when using abciximab. Allergic reaction: allergic reactions to abciximab are rare but may occur. Precautions: pregnancy and breastfeeding. Abciximab has not been adequately studied in pregnant and breastfeeding women. Therefore, caution is advised when using abciximab in these populations. Precautions: patients with a history of bleeding disorders. Abciximab may increase the risk of bleeding in patients with a history of bleeding disorders. Precautions: patients taking anticoagulants. Caution is advised when using abciximab in patients taking anticoagulants, as concurrent use of these medications may increase the risk of bleeding. Precautions: patients with liver disease. Abciximab may accumulate in the body of patients with liver disease, so appropriate dose adjustments are required. Drug interactions: abciximab may interact with other medications, such as anticoagulants. Concurrent use of abciximab with anticoagulants may increase the risk of bleeding. Thrombolytic agents: abciximab may increase the risk of bleeding when used concurrently with thrombolytic agents. Drug interactions: dextran. Abciximab should not be used concurrently with dextran. Notes: abciximab is a potent medication and should be used according to the physician's instructions. Before using abciximab, patients should inform their physician about their medical history, medications currently being taken, and pregnancy or breastfeeding status. Notes: if a dose of abciximab is missed, the patient should contact their physician for advice. Do not stop using abciximab without consulting a physician. Store abciximab in a dry, cool place, away from direct sunlight. Conclusion: Abciximab is an effective medication for inhibiting platelet aggregation and preventing thrombosis. However, it can cause some side effects. To ensure safety and effectiveness of treatment, patients should follow their physician's instructions and inform their physician about any health concerns.